Hello, I'm Jessica Samuels, and welcome to A Way Forward, presented by Beem Credit Union. I'd like to acknowledge that this podcast takes place on the ancestral, traditional, and unceded lands of the Okanagan Syilx people. My co-host, CMHA Kelowna CEO Mike Gawliuk, and I are going to talk about mental health and caregiving. We're going to dig into the details of a recent Caregivers mental health survey, and we're also going to talk about things that you should watch out for with your own mental health while you're taking care of others. Mike, the definition of a caregiver can be quite broad, but let's take a stab at it. What does it mean to be a caregiver?
So a caregiver is somebody that offers support, care, and assistance to those that need it most, whether that's supporting an elderly parent, a person with disabilities, someone experiencing or recovering from an illness, or those struggling with mental health issues. Caregivers provide emotional and physical support that enhances quality of life.
And what's also interesting and embedded within what you just said is that there's actually different categories of caregivers. And so there's the professional caregivers, which I think some folks might jump to right away, right? And those are the folks who are paid to do it. That's the simplest way to explain that. They're certified and they're employed in that endeavor. There's the family caregivers, which was embedded in what you just said there as well: parents, spouses, children's, siblings. And then there's the volunteer caregivers. I think when we were experiencing pandemic, and we talked a lot about the mental health of the professional caregivers. So that one category I was talking about, rightly so. We had folks who were on the front lines managing this incredible health crisis. And it's important to continue to talk about the work that professional caregivers do and the mental health supports that they need. For the purposes of today, we're going to talk about really the folks that fall into that middle category, which is the family caregivers. And this is interesting because these are folks who are not necessarily trained to be in this role. Mm-hmm. They're not paid to be in this role. And this is on top of oftentimes regular life stuff and regular jobs. So we're going to dig into that a little bit. A couple of stats here. You know how I always have a few stats that I have to read. Approximately 5.7 billion unpaid hours in Canada are being offered by caregivers. 5.7 billion unpaid hours.
Yeah.
That equates to 97.1 billion in the value of work, unpaid work. So these are dollars that are unpaid. This is the type of work that the family and volunteer caregivers are giving. This is significant. Sounds like it's unsustainable. So this is where I hand it over to you. I know that we had a recent survey and discussions about it, but really the mental health of caregivers has to be addressed.
Well, absolutely. And certainly for organizations that are in this space, and we'll talk about a little bit about them, they've kind of identified the tidal wave that's coming, because there's a population of boomers that haven't hit necessarily the age where they're going to need a level of care. Mm-hmm. And basically at this point in time, the data say that basically there's 8 million Canadians that care for family and friends. That's 1 out of every 4 people. That's going to continue to increase to the point where it's going to be 1 out of every 2. And when we talked about the dollar value in regards to that, in preparing for this, one of the things that I identified was that for every $1 that goes out for paid caregiving, $3 are used on with families that's unpaid. Wow. And so it's ultimately very significant.
What's interesting to me, as you just demonstrated in that fact as well, is that we're talking about when we go back to that professional caregiving, an overburdened system, which we've mentioned, right, several times. But if we're talking about 1 versus 3 here, there's an overburdened system of the unpaid folks, but that is not sustainable.
Mm-hmm.
And when we talk about the emerging boomers, we talk about most caregivers not most, 1 in 5 caregivers are at or over the age of 65. I feel like this is going to spill out into that professional caregiving category and further impact a system that just doesn't seem like it'll be able to bear it.
I think that's the concern, and the Canadian Centre for Caregiving Excellence has really focused energy on that. They're an organization that supports and empowers caregivers and care providers, advances the knowledge and capacity of the caregiving field. So that's also for paid caregivers, but also advocate for effective and visionary social policy. And a year ago, released a document, which was a bit of a bellwether and a canary in the coal mine of this is the situation that we're in. And if something significant isn't done, we're in big trouble, right? And so, as with a number of the issues that we talk about on this podcast, there's a higher level policy and government response that's required. Certainly for those caregivers that are doing it day to day, there's the things that they need to pay attention to in terms of taking care of themselves, and we'll talk about that. But also wanted to point out that there actually are some countries that have caregiver strategies that are far more advanced and evolved than our system. So we have a staff person who is a family navigator who works at Foundry and is from the UK and has had extensive experience supporting caregivers in the UK. And certainly what she identified was that Australia, Germany, and UK are leading the way. And how they're doing so is that from an economic standpoint, if people aren't necessarily able to work because they're caregiving, that's a problem. Family caregivers that provide over a certain number of hours per week of care get a caregiver allowance. So they're actually getting some financial support for their work. That respite care is available. And respite care is, again, one of those strategies for the caregivers to take care of themselves in the face of their caregiving role. And there is also, because you mentioned, again, people not necessarily having training or education in this, there's education and training grants available for caregivers to learn more and to enhance their skills. And then one of the things, and we see it in Kelowna with a project like Foundry or the Family Connection Center. In the UK, most cities have caregiver hubs, and that's really where that people can access support around connection to services. There's caregiver groups and activities. They can apply for benefits and the completion of caregiver assessments. So there is good work that's being done elsewhere that certainly could be replicated, and ways of addressing some of the challenges that happen for caregivers.
Right. Another distinction I'd like to make, and it just made me think of it there when you were talking, is that we oftentimes, you and I on this podcast, have talked about caregivers as it relates to family of young people, so caregivers of young people. And during the research for this, it was really interesting to me how and what we're going to get into about the mental health of caregivers that next little bit. It's different when you are a caregiver / parent, so of a young person. Not saying it's not hard, there's not challenges, and there are support systems and networks out there. You just gave examples of earlier. The difference between being a parent caregiver versus somebody who is aging, who has a chronic illness or what have you, is that when you're a caregiver as a parent or of a young person, generally speaking, is improving each day. They're growing. maybe improving is not the right word. They're growing, they're getting older, they're becoming more self-sufficient, so in terms of, think of a baby to a toddler to a youth and so there's that idea that you see change and improvement. And so your role as a caregiver becomes different and then sometimes, is weighted differently. When you're a caregiver of an older person who are individuals who are chronic illness or near end of life, it is different. It is not the same because there is not an opportunity for that improvement or self-sufficiency. Perhaps you're a long-term caregiver of somebody who has an illness. Maybe that will come, but maybe that's not going to come for 5 or 6 years down the road. And that was a really interesting distinction for me. And as somebody who's kind of been in that category of supporting folks in my life who are older adults, and supporting folks in my life who have had episodes and periods of injury, long episodes or continuous episodes of injury or illness, it's tough out there.
Oh, 100%.
And so let's talk about the mental health. All of that, a long explanation to say, let's talk about the mental health impacts of being a caregiver. Let's start off with, it can be rewarding. Certainly, we don't want to have this doom and gloom perspective. It can be a very rewarding experience.
Yeah. Well, and I look at my own personal experience and my caregiving experience with my father, who passed away a couple of years ago, was very short. Like, he moved down with me. He lived in my home, and I had to undertake some caregiving responsibilities until he passed. And I can just say that experience, as short as it was, certainly makes me see like the multiple challenges that comes with caregiving. But yes, there are positives that come from it. One study actually identified that for some caregivers, caregiving actually extends their lifespan. Other benefits just include increased self-esteem, the gratitude and recognition that they receive from care recipients, and how that can strengthen the relationship between the caregiver and the person that they're caring for. So it's not all bad, but there is a heavy load, and there's a lot of things that impact caregivers on the negative side of the ledger, and those are some of the things that we want to identify and then talk about how people might be able to address that.
Yeah, well, let's do that as well, because I think I don't, put too much of my own opinion in this, but when you're in those situations, and maybe you can identify the same, if you feel like you're full up with your job, life, caregiving, you feel like you don't have time for those pieces, those other pieces. Like if you can get to bed at a reasonable time and get up at a reasonable time, remember to have something to eat, that's a win. But you need more than that to manage your mental health.
Oh, for sure. I remember sitting in this room doing an interview with a prospective staff member when my phone went off, and it was the life alert system, and saying, "Oh, by the way, your dad's fallen." I had to excuse myself from the interview because there was nobody else that could go, and I had to go up to the house and see if he was okay, and then get him back up and moving, right? And so, yeah, it impacts things considerably. When we talk about the CCE and some of the work they've done in caregivers and sort of sending the alarms signals, they've identified some stats that are concerning. So they identified that 1 in 4 caregivers report fair or poor mental health, that there's increased fatigue, anxiety, and sense of overwhelmed because of those care responsibilities. We talked about those that are seniors that are caregivers, who may also require care, and are the least likely to access supports or services to help with their responsibilities. And one of the tolls that, and we sort of touched on it briefly, it takes is that one of the most common impacts for people is around the financial toll that caregiving takes. And half of the caregivers that they surveyed had faced financial stress in the past year, right?
And just by you saying that, I hearken back to what you said earlier. Think about those European countries that have financial supports and repayment in that. So really, that would be an incredible thing for us to have here. That financial toll is a heavy burden, and with it comes with its own mental health impacts.
For sure. And then when you look at diverse communities, there's additional gaps on top of that. So racialized, Indigenous, LGBTQSI+, are more likely to experience negative aspects of care. And half of racialized caregivers have faced financial hardship. So again, when we look at the impact overall, it's significant, and it's concerning, which is why it's important for organizations like the CCCE to exist and advocate strongly for government to invest and make this a priority. But in the meantime, you're a caregiver. You're experiencing some of the challenges. What do you do?
Right. First, actually, before what do you do, I think it's recognizing what you're feeling, recognizing what's going on. Because I'm worried that you might get into a cycle of being tired and down and just think it comes with the job, comes with the role. And it's a tough role, but don't just accept it and think that it's okay. So recognizing those typical things that we have talked about before when it comes to low mood or depression or not feeling like yourself, sleeping more, not at all. Not eating or eating differently, eating more, use of substances, alcohol more or less, and those things where you just know that you're not the same.
Yeah. You're not yourself for sure. I think you make a good point. I think there's a level of awareness around the impact that can come with that. I would say when you're caring for someone else, and it's that airplane analogy, right? When the mask drops from the ceiling, put yours on first before you put on the other person's. And there's, again, various strategies that you can utilize to try to take care of yourself before it gets to the point of burnout, before it gets to the point where you have to seek out therapy, medication, those kinds of things. And they're pretty straightforward, but they might be challenging for some based on circumstances. Simply, in some cases, take some time for yourself where you can, because again, it can be all encompassing. Ask for and accept help for assistance with daily activities.
That second part, that accepting help, is such an interesting point, right?
Yeah.
Like that's kind of like, no, I've got this. This is my burden. This is my mom, aunt, partner, to manage. I don't want to put that burden on somebody else to do it, but it's such a critical piece.
Well, and that shared responsibility hopefully keeps everybody healthier, right? Of course, we always talk about get connected, become aware of caregiving resources in your area. And that could include any number of things, including like classes or ride services, meal delivery, house cleaning services, those kinds of things. So familiarize yourself with those in order to see what you can put in place. Consider joining a support group, right? In some cases, you might feel like you're the only person in the world that's having this experience. And when you get together with others that are having similar experiences, it's a good way, first of all, to socialize and relate. And it's a step you can take in, again, taking care of yourself.
Mm-hmm.
Yeah.
Yeah. Oh, well, and one other point I was going to make along those lines was that oftentimes if you're caregiving for an individual that has a specific illness or something like that, there's also specific caregiver groups associated with that.
With that specific illness, for sure.
Yeah. So, Alzheimer's or cancer, a lot of folks think about. There are support groups like that.
Yep. And we'll mention a couple of resources. A couple other things, if possible, finding respite care, getting some time away, just to really focus on some self-care is important. I think when things become overwhelming, when some of those symptoms that start to show up around depression, I think one of the things that you see take place is people sometimes tend to socially isolate. That's really the last thing that you want to be doing.
The opposite of what you should be doing.
Really, ideally staying connected with family and friends. Again, if there's one thing we'll get from A Way Forward, is the importance and the power of connection and what a difference that can make for people. And that's absolutely important. And then of course there's the basics. Try to take care of your health, right? And that comes down to trying to get enough sleep, eating healthy, exercising, those kinds of things that help us to stay well.
Right.
Yeah.
Okay. Good practices. Let's go back to some of those resources as well. So you mentioned Foundry while we were in this conversation. You did talk about CMHA, and they have a ton of even links to caregiving or different resources on their website as well.
So, I mean, of course, in preparing this, taking a look, like all the different resources that are available that would appear across the country, whether it's a specific, for something specific, like you say, like Alzheimer's or cancers or whatever it is, there's like a huge list of resources. You can go there. It's really a one-stop shop to take a look at what you can match up with and find some of the assistance. There's also information and resources that are available to help educate. The other one that is available is Family Caregivers BC. And I went and took a look last night. They have an online caregiver assessment. And I would say from doing it, just experiencing it, anyone that gets into a caregiver role, doing that assessment would be super helpful because it leads to some of the points that we've already talked about, right? And certain situations where things are going to look a certain way now, but those may change with time. And it provides information. And again, there's resources on there, there's podcasts, there's other information. So that is also a wealth of resource for caregivers. For me, the thing that stood out was the caregiver assessment. And in terms of getting a sense of where you're at and where you might be able to go, that's an excellent step to take.
Right. Don't wait till you're burnt out. Don't wait till you can't take it anymore before you do that assessment. Don't self-assess before you take the assessment. Why don't you go out and see, early intervention, prevention, those preventative measures that we always talk about, they also apply to you as a caregiver. You can, support yourself early so that you don't reach rock bottom. For sure.
And there's lots of tips and tricks like we talked about. And then there's also information and things in there like when you have to navigate the formal care system,
right, which
isn't always particularly easy. And so resources that are helpful in terms of helping to educate people on how to do that. And so certainly I would encourage people to check those resources out as a great starting point to get connected with supports and information that they need that might help to make their experience of caregiving a little bit less stressful and allow them to take care of themselves as they do it.
Thanks so much, Mike.
Thank you.
Okay, so we just rattled off quite a few resources there. We are going to add those in the show notes. We are also going to, of course, add them to the A Way Forward presented by Beem Credit Union podcast page. And that is at CMHAKelowna.org. Really take some time to check them out, even if you just know somebody or you're just wondering where you are at your caregiver journey. And of course, as always, in the meantime, please do take good care. Beem Credit Union supports mental health initiatives across British Columbia because caring for each other builds stronger, more connected communities. United as one, Beem's founding credit unions now serve 190,000 members across BC.